Perfection or not? Now that is an ADHD conundrum and a dilemma we are having to confront. Get caught up in the endless quest for perfection and risk missing the boat, or release attention talk video with its imperfection. We say done is better than perfect and are releasing attention talk video as is. We believe good content is good content. So what if we have a few production glitches? If you have ADHD, follow our lead. Don't use perfectionism as a reason to procrastinate. Welcome to Attention Talk Video. I'm your host, Attention Coach Jeff Copper, and with us today is Dr. Charles Parker, and our topic is ADHD medication rules, paying attention to the meds for paying attention. Specifically, we're going to be talking about Chapter 6 of Dr. Parker's book, Measure Metabolism. So real quick, Dr. Parker, welcome to Attention Talk Video.
Hey Jeff, thanks for having me. This innovative way to talk to you. It's great.
Yeah, well, this is a lot of fun. It's funny. We got two characters that are learning technology at the same time to make this thing happen. So it's if we can pull this off, anybody can pull it off.
Right. That's the way I feel about it.
I wanted to have you on the show here. I had interviewed on our radio show, Attention Talk Radio, some time ago about medications, and one of the things that struck me is medications for ADHD are quite complex. And one of the things that you said is the meds have to go through the body before they get to the brain, and there's so much that can obstruct the ability of the meds to actually get to the brain and do what they're doing. I realized how complex this is. It's just not like take 2 aspirin and call me in the morning. And your book, particularly Chapter 6, details some of this stuff. So when we talk about everybody's different and it does have to go through the body does have a very big impact on the ability for these stimulant medications to be effective for those with ADHD, correct?
So true. Absolutely. What happens is, the key word there is metabolism. It's sort of not on everybody's lips to think about metabolism, but it has to do what your body does is it actually changes the rate at which the medication is burned. So if your body's operating at one level of efficiency or another level of efficiency, that can be determined on a clinical interview by asking some key questions. And if you really don't know what's going on and assume, which many do, myself included, I used to be this way, that the medication would just pass from the lips into the mind, it doesn't work that way. It's like saying, I'm going to go to South Africa this afternoon, but I'm not going to make any travel plans. And so what happens is if you really think about the fact that the body's going to change the medication and the rate of burn, then all you have to do is assess things that would affect that rate of burn.
And so one of the things is when you take the medication is it actually has to get into the system, which takes place in your digestive tract, correct?
Yeah, it does. But, it's interesting. Some of these new medications like Vyvanse, for example, it does come through your digestive tract in one form, but it doesn't actually become operational until it's cleaved in the red blood cells. The amphetamine this is a little deep, but it comes off of the lysine amino acid molecule that it's stuck to. It actually happens to the red blood cells. So that's one of the reasons. That's a metabolic point right there that I zip by very quickly. The nice thing is, this is a recording. You can replay it. But the bottom line is, when the medication then becomes operational, then it's still released very, very slowly. And that's a metabolic rate thing, as opposed to, for example, an immediate release amphetamine, which sometimes when you take it, boom, you're out the top of the window very quickly, without even knowing what happened, because it went right through your gastric mucosa. And it did go pretty quickly into your brain.
But one of the things that was interesting to me is that if your digestive system isn't working properly, like for lack of a better term, it's stopped up a little bit, or it's moving kind of quickly, that can impact the medication's ability to get into your body and move from there. Am I interpreting that correctly?
Absolutely. There are a number of things that can influence it so that it won't work at all. So there are other things that make it just boom, hit you too quickly.
Yep. So the factors that go into this, and we'll get into some details, are like food allergies that can impact it, right?
Food allergies are very, very frequently overlooked, and surprisingly, absolutely surprisingly to me, controversial. And food allergies are enormous. They're one of the big things that we see with people who have bounced and not gotten well and tried many medications. It doesn't matter whether we're talking about stimulants for ADD or antidepressants. They bounce and they are all over the place, and you come in and one of my favorite questions is how many times a day do you go number 2? And why do I think about number two? Why am I a number two guy? Well, first of all, there's some comic relief in a difficult moment. But the other reason that I'm into number two is it works so predictably well. The GI system from the mouth to the south is the main immune organ for the body.
Uh-huh.
So if you have a food problem of some kind, then what's going to happen? That food will cause the metabolism that we were talking about a moment ago to change, and the rate will change, and you could be extremely reactive to a small dose of medication, what looks like a very rapid metabolizer, or you could be absolutely take tons of medication, which you see all the time, and they still don't get better, and they need more.
So just for the viewers out there, I mean, the issue here is we haven't even talked about the effectiveness of the drug in the brain. We're talking about the ability of the drug to kind of get to the brain. And one of the things that you talk about is the digestive system in number two. And you actually have a fun little test that anybody can do to actually kind of see if your digestive tract is on. You referred to this as mouth to south, but I think the test actually involves a can of corn, correct?
Yes, it's the most expensive test in medicine. 69 cents at your local grocery store. And then you just eat the corn on an empty stomach, look at your watch, and look at your watch again when it passes. And that's the time. It should be 18 to 24 hours. If it's less than 18 hours or more than 24, it's highly likely. I'm not saying that everybody listening to this has a definite problem, but it's highly likely there's a significant problem.
And this is just a simple test anybody runs. So if you've been trying stimulant medications, they don't seem to be working, just eat a can of corn on an empty stomach, time it, and hopefully that corn should pass in 18 to 24 hours. And if it's outside that window, it doesn't mean that there's something at issue here, but it means that you should probably have it check it out because something could be blocking or inhibiting the ability of the stimulant to be effective.
Well, and here's the real thing. I had a project manager, a construction guy, macho hot dog kind of guy. And he took the corn, and well, first of all, he resisted doing it, but I'll just make this story very short because of the time. But he said, I don't have a problem. I go every day. I've gone once a day my whole life. Parker, why are you bothering me with this? Well, the medications were not working predictably. When the medications don't work predictably, we have to dig deeper. So I said, look, you just got to do this. Just go ahead and do it.
Yep.
10 days. 10 days is what it took to pass.
Wow.
And this guy was toxic. Seriously toxic on his own doo-doo.
Wow.
And what was going on is that's the reason the medications were, I call it a bulletproof liver. They were ricocheting off his liver. He couldn't take anything. Even the smallest dose created a big problem.
Well, you mentioned that bounce off the liver. Once the meds get in, they get into your body, and then isn't the liver kind of has a role in this? It detoxes the body among other things, but if your gut's not working so well, then the liver kind of kicks in. I mean, isn't there a relationship between those two that would effectively bounce those meds out?
Yeah, the liver's kind of the second level sewage treatment plant, amongst other things, but it is an organ of detoxification, and if it's been loaded with toxic elements on a regular basis, you can go to your doctor, get a liver profile, and find that it looks quite well because the liver cells aren't dying. You don't have a significant compromise, but the rate of metabolism of the liver, we've seen it repeatedly happen in the office, changes. So then what happens is if you get the bowel squared away and get it all corrected, the medications that run up through the liver pass through that cytochrome P450 system efficiently, and there's no problem.
So in totality, we started the burn rate of your body to pass this stuff through is really important when you take a look at these particular medications. We're talking about things that can block, increase the burn rate, decrease the burn rate, which can either allow the meds to pass right through and never really make it to the brain, or to accumulate to almost kind of a toxic level and create problems on the other side. Is that a good summary for what we've talked about so far?
That's a good summary, and that person will feel very frequently, and this is the punchline, suicidal because they're untreatable. They are in fact untreatable as long as you don't know that. Then when you know that, they're treatable again.
Yep. So other factors in it are, we talked about your digestive tract, we talked about your liver and stuff, but there's certainly food allergies, and there's other issues that can impact it, like hormonal imbalances in women at certain times of their life. Is Is that?
Well, it's funny that we oftentimes are treating ovaries with antidepressants, and that doesn't really make any sense. Yes, we can treat the derivatives of ovarian dysregulation, like estrogen dominance, that may have a depressive component to it. But so many people don't really pay attention to significant hormonal imbalances, adrenal fatigue, estrogen dominance, and treat it all with psych drugs. Instead of saying, look, this is a underlying problem with a different body organ. It's like we're treating heart disease with diabetic medications. It doesn't make any sense at all.
Which actually kind of brings up an interesting topic, because another issue that can have an impact on the medications, again, just getting to the brain to be able to do their job, are drug interactions with other medications. At least that's what I took from your book. Is that accurate?
Oh yeah, that's another thing that we really do need to pay attention to. And there are specific drugs that actually block the pathway of the, especially ADD medications, coming up through cytochrome P450, 2D6. You can look it up on, you can Google it since you're looking at this as a video. 2D6 is a pathway, it's a pipeline in the liver that amphetamine products run up through. And two drugs very significantly block it, and two others to a lesser degree. Prozac and Paxil significantly block 2D6 and cause those amphetamine products to accumulate. I'm going to have to throw one other quick variable in here. That 2D6 pipeline has a genetic variability on top of the problem with the Prozac and the Paxil.
Wow.
So if you have a genetic variability where it's narrow and you got the Prozac and the Paxil sitting on top of it, that person's going to get toxic very. And they don't get toxic right away. They get toxic over 3 months, and then they're
it takes a while. And we are everybody listening to this. There's a whole area on drug interaction, and we're hopefully going to make another show that we're going to talk about that in detail, because one of the things you talk about is drug interaction takes a while to show up, and ADD stimulants are kind of like the bad guy. They get a bad rap, so they're kind of blamed first. So there's, again, that's a whole nother space. But we've got about 2 or 3 minutes left, and I also want to do another show on these 3 concepts that I want to talk about right now, but I want to lay them out, and that is, we've talked a little bit about the burn rate and metabolism. I want to touch base on duration of efficiency and the therapeutic window. And again, hopefully we're going to do a more in-depth show on this, but at the most basic, your body is burning this stuff as it goes through the system. And if I understand the book correctly, stimulants got a duration of efficiency. In other words, it takes them a certain period of time to go through and be burned through the system. And if they're being burned too quickly, or not being burned too quickly, which you can tell by the effectiveness of it, then that gives you an idea that there might be something inhibiting it, or it's moving too quickly through your system. And that's when we start talking about the therapeutic window. Have I framed that out accurately?
You have very well. I mean, the real bottom line and the reason for people to come back to these next shows, and I really appreciate having the chance to spread the word with you, Jeff, is that these are all able to be assessed in a clinical interview. We don't have to run a big line up somebody's veins and do a brain scan on them to figure this out. This is stuff that if we ask the questions correctly, you can have a significant resource for improvement. It's simple.
So again, we're going to talk about that under another show, but your metabolism is burning that stuff. The meds are designed to last a certain length of time, and if you can tell if there's something wrong in the system by if they're being used up too short or too long, and in the context of the therapeutic window. So again, we're going to do another show on that and get in depth, because that can kind of help you understand what's going on. But with that, Dr. Parker, we need to kind of wrap this up a little bit. For those that want to learn more about yourself, get the book, what's the best place for them to go?
Well, the easiest thing is just go to drcharlesparker.com. I got a website up, and it's an easy connection place, and I've got all the different social media connections and the different training sites and so on set up there. So.
There's a ton of stuff there. So again, Dr. Parker, thanks for coming on the show, and that's it for this edition of Attention Doc Video. Take care, everybody.